About 100 million people in the United States are estimated to have fatty liver disease not caused by alcohol. It's the most common form of liver disease in children and has more than doubled over the past 20 years. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker takes a deeper look at the causes.
Non-alcoholic fatty liver disease, or NAFLD, is the liver manifestation of the metabolic syndrome.
Dr. Naeem Al-Khoury, a transplant hepatologist at University Hospital and the Texas Liver Institute, says the disease can show up in kids and adults.
It's related to eating unhealthy food and having sedentary lifestyle and then gaining weight, and then the fat can accumulate within the liver.
To catch it early, a primary doctor must do lab tests to check for elevated liver enzymes, but the disease is often asymptomatic.
The most common symptoms are fatigue, so excessive tiredness, and sometimes pain on the right side where the liver is.
But symptoms often don't show up until the disease is in advanced stages.
About 1/3 of patients with fatty liver disease have an entity we call non-alcoholic steatohepatitis, or sometimes we call it NASH. And these are the patients that I worry about.
Those are patients at risk for developing liver cirrhosis and end-stage liver disease, many requiring a liver transplant. Some of the risk factors for fatty liver include obesity, high blood sugar, type 2 diabetes, high cholesterol, and an underactive thyroid. But there is also family history and a genetic predisposition to the condition.
We know that Hispanics, Latinos have actually higher prevalence of fatty liver disease.
For adults, the national average for those with fatty liver disease is about 30%, and for children, the average is about 10%. But in San Antonio, those numbers are much higher. About 45% of adults here have fatty liver disease, and for children, that's 20%, or twice the national average.
That's why fatty liver disease is an epidemic in our area in San Antonio.
Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of Wear the Gown stories. Just go to wearthegown.com.